actually a community speaker, and he is pioneering new spaces in religion and spirituality for 21st century individuals. So, here to offer his perspective on caregiving in the healthcare fields is Russell Floyd, founder of Solo Fide.
Thank you. If you don't recognize that good-looking guy in the picture, that's me. In 1983, soon after I'd finished my own clinical pastoral residency program at that time Baylor University Medical Center. Not unlike some of the clinical work that you do, but done for pastors. I'll never forget my first day there. My first day there was they did that hour orientation, and then we got our first assignment. They said, here's what we want you to do. We want you to go visit one person who is about to have surgery that next day. I was given an 80-year-old female who had cancer. Now I know she was probably receiving treatment for some relief. Knocked on the door, introduced myself, inquired how she was doing, prayed a quick prayer, and got out as quick as I could. You remember the first room you walked into, perhaps. We were to go back and give an oral verbatim of our encounter, the 6 residents. And we did, and I did. And when I got through, the big cheese, Dr. Joe Gross, the head supervisor, in fact, all the supervisors had shown up in the room to check out this new batch of residents. The big cheese turned to me and said, whoa, where in the hell is the good news in that? Now, you can imagine the look on my face. But let me tell you, that was a question that began to stay with me throughout the remaining days of my training and throughout the remaining days of everything else I've done. It was a well-timed question. It put a new light on an overused, loosely used religious phrase called good news. And I had to really think about what that meant. And so as I worked my way through the residency program, I came up to the most profound idea of what good news is. Isn't profundity usually simple? Good news is simply offering the right dosage of kindness at the right time. And I began to see its power. I watched when it was offered genuinely how it could jump over cultural traditions. I watched how it moved around those kind of fences that faith communities like to build simply by offering that kind of good news. At its best, it connected people together. And so I left my residency program determined that I would somehow connect religious and spiritual care and good news all together in the work that I would do. Now, I had no idea what I was about to face. This was 1983, 84, and I didn't really know how hard it was going to be to keep good news and religious and spiritual care living together under the same roof. You know the stories. They kept getting told in the newspaper. Religious scandal, deceit, hypocrisy, year after year as they built upon the years that I served. You can all tell your own stories, can you not? About unkindness found in the religious precincts. From one who's been on the inside for a long time, you cannot imagine how hard it's been to keep religious and spiritual care and good news living together. Well, I knew I had to do something. And I knew that I couldn't do anything. I couldn't do everything. It's a comprehensive issue, a question that really is a 21st century question that deserves a 21st century answer. And while I was limited in what I could do, this former pulpit jockey became a spiritual entrepreneur. What does that mean? Well, I began to wake up every morning thinking about, as I left what was the comforts of a pulpit, how is it that I could live into offering the good news of kindness and caring for others and at the same time call it religious or spiritual? You talk about target audience or who do you focus on? Well, my focus became on persons who are spiritual and may or may not be religious. And that's my work today. I could tell you about it another time or during the break. But I want to invite you to help me. you can join me in this work. You say, how? We're not a chaplain, we're not a pastor, we are medical health care providers. Well, may I just ask you to entertain the possibility that the persons that you will deal with day by day have more need for the good news of kindness than the average, let's say, Adam, Amal, Jose, or Jennifer, or Beyonce, or Benjamin. For you see, 100% of the people that you work with, when you walk into a room, feel like their game is falling apart. 100%. Whether that be their risk of losing something, whether that be their own life because they've been told their days are numbered, or they're at risk of maybe losing some major bodily function, or maybe it's not quite that serious. They're just at risk of losing a few days because of a medical setback that they're having to face, or a pain that may be slow to subside. And so when you walk into a room, they need some form of your good news. You say, well, what can we do? Well, when you walk into a room, you can diagnose. You're already doing that already, are you not? Now, I admit, the first thing a person needs whose game is falling apart is a medical diagnosis. But they also need persons who will be willing to discern what is it that we can do to speak to this person's inner self, to give them the kindness and the goodness that they need while they face this trial. You can do that. You can do that if you're a person who develops the ability to see beneath the skin. You know, that contemplative kind of diagnosis that looks deeper than just the five senses that you will use when you walk in a room, but goes deeper than those five senses and begins to think, what wondrous thing might our team do, be, or say in order to provide the goodness and kindness this person needs? Yes, but also in your diagnosis, you need to remain open to the person's uniqueness. You won't divide or judge those usual differences that we all see in each other. You won't even let the little quirks bother you. I mean, you won't even, those kinds of things that you might say, about, you'll remain open to this person's uniqueness. And you'll let those things inform you on how you might deliver in a moment or dispense the goodness they might need in their situation. For you also, when you walk in a room, you can't just diagnose. Eventually, you do some dispensing, do you not? When a person feels like their game is falling apart, the best thing you can dispense is your full presence. Someone who knows that you're fully present with them when you're present with them. It means you won't shy away from their tears, or you won't shy away from their pain, nor their cursing, or their craziness. You will just simply say, I'm present with you. I understand this hurts. You reflect back honestly what they're saying or feeling. I know you're scared, or however you may say it to what they're saying. And when they realize that you're fully present with them and you are dispensing your full presence, you're actually doing some of your best work possible you'll do on any floor of any hospital or any place you work, because now you're providing your empathy. Empathy is a word that didn't enter the English language until 1908. That's probably another TED Talk. But while it may be a new word for the English language, it's a well-practiced word in the medical field. It's always been a part of your best practice to offer empathy. Empathy is the highest degree of medicine you can offer. You see, empathy has the ability actually to bring healing to a hurting body and, of course, relief to an aching heart. Let me tell you a story. 2009, my congenital heart defect had worn itself out, and I needed an aortic valve and an aortic replacement. So I went to have my surgery done. Obviously, it went well, you can tell. But at the end of that third day, that hard third day after an open heart thoracic surgery, I was tired, I was worn out, and a good doctor came to see me who drove 100 miles away to come see me. Too bad he didn't know anything about cardiac care. He was an ENT. But he was also my friend. And he came and sat by my bed at 8 o'clock that night for a good 30 minutes. He too had been through something similar, offer him his support, his encouragement, his presence, his empathy. When he left, I looked over at that evil spiral meter sitting next to my bed. Most of you know what that is, even though you may not be a respiratory therapist. And I had found new strength to blow in that blue barbaric tube, knowing it was the only thing between me and going home. Dr. Bill Dietz offered some of the best medicine I've ever been offered, though I had some of the best surgeons I could have. You see, my friends, I think if I had a big idea here that I want to pass on is religious care needs to go to rehab. What I mean by that is that religion needs to discover what it really is, what it really means. For religion comes from a word, the relegar, which means to reconnect. Go figure. And my friends, if religion will go to rehab and can find its way to recovery in order that it can reconnect the good news that it's about, my friends, I think it might be made well. It may take a long rehab stay, but I'm committed to walking with it day by day until it finds its recovery, to one day to where it speaks good news again. Back to you. My friends, there's a lot of things I can't do, but there's some things I can do. By the way, are one of you in this picture? I can encourage others to join me in this movement of connecting good news back to good care. So you can be the good news by paying attention to your patients, by, of course, offering the compassion you do when you walk into a room, by offering your full presence, by offering your empathy beside your best trained skills. You can, too, be the good news. So I'll just leave you with those words. Be the good news. Be the good news. Be the good news. Oh, I know it's hard to do while I'm talking. So I'll exit stage right and say thank you. Thank you very much.
I believe in a better